Good afternoon, all. Are you able to hear me? Did everyone have checked my message that we have class today? So only 2 more left. Let them join back. So today we will see about hydrotherapy. So I was planning to take coordination, but I saw your with some topics. I think you have hydrotherapy, so I thought I'll just explain the practical aspects of hydrotherapy so that it is easy. It will be easy for you to write your SEQ. But usually we will be taking this hydrotherapy class in the swimming pool in Ames campus. But present condition, I don't know whether we will be able to have face-to-face class. So I thought, okay, I will take online itself. So in case if you are coming back to university, then we will have one session of hydrotherapy in our swimming pool so that you can all know about the properties of water and you will be able to feel the properties of water. Meanwhile, you can just practice these things in your home. You can take a tub and you can use your hands and just feel the water properties and just try to do. Right. Are you all there? I think suddenly the internet was.
Yes, miss.
Okay. So, like, if you come back, then we will see that in our swimming pool. If not, you just try in your home with a small tub and use your hands and try to feel the water property. Is that clear? So I hope you know that there is four water properties. One is buoyancy, hydrostatic pressure. Then another two. Can anybody just say what are the other two properties? What are the four properties of water? Theory is already over, right? Next week you will be in. Next week you will have your mid-sem. Okay, so buoyancy. Then tell me what is buoyancy. Can you just unmute your thing and you can tell? Okay, so viscosity, water buoyancy, surface tension, and hydrostatic pressure. So what is buoyancy? What is buoyancy? Have you all started to read or not? Okay, at least say something that I know that somebody is there. Okay, so buoyancy is upward force that works against gravity. So when I give you a break time, you can just feel all these four properties in a water tub. Then it'll be easy for you to understand. So first thing is buoyancy is upward force by the water. That means when you go and put your hand inside a tub of water, the water will try to push out your hand. So that means it will try to push out so that your hand floats. So that property is called buoyancy. So always water will be pushing upwards. Then second is your hydrostatic pressure. So hydrostatic pressure is pressure exerted in all the direction of the water. That means when you put your hand inside the water tub, the water will be exerting a pressure in your hand so that your hand will be compressed in all the direction equally. So that is your hydrostatic pressure. So your first property, that is buoyancy, you can use it for your you can use it to increase the resistance or decrease the resistance when you are doing the movement. Okay. uh, Otherwise, just a minute, I have got a call from office. Okay. So first, that is the buoyancy. You can use this buoyancy property to increase the resistance or to decrease the resistance. So how means when you are positioning the patient towards the buoyancy force, then it is assistance or it will help you to reduce your resistance. Is that clear? So for example, in a tub of water, you put your hands inside till the shoulder, and if you do elbow flexion, then it is assistance by buoyancy. So buoyancy will help you to assist in doing your elbow flexion. Is that clear? So that is the use of your buoyancy property. So in case if you're doing extension, the extension of elbow, that will give you resistance. The buoyancy will be giving you resistance. So same water property you can use in three forms. That is, either you can use it as a assistance, or you can use it as a resistance, or you can use it as counterbalancing. So same like your manual, normally in manual resisted exercises, we will be having three types. One is assisting, another one is resisting, another one is counterbalancing. So same thing we are going to use in water. So this buoyancy will be helping us like gravity to give assistance, to give resistance, and to give counterbalancing. So only thing is the gravity will be acting opposite. That is, gravity will always pull everything towards the floor, but water will be always push everything upwards. So that is the only difference between the gravity and the buoyancy. So, but both we can use it for assisting, resisting, and counterbalancing. So first example I'll give you is whenever you want to do something, like whenever you want to do, maybe we can take up biceps itself. So when you are putting your hand inside the water tub and flexing your arm, then it is assistance by buoyancy. Okay. At the same moment, when you are keeping the shoulder in abduction, and doing elbow flexion, then it is counterbalancing buoyancy. Is that clear? Same thing when you are doing in prone lying and do elbow flexion, then it will be okay. That is also okay. So for elbow flexion, you can. Okay, so for elbow flexion, you need to do in prone lying with shoulder abduction. Then that will give you resistance by buoyancy. Is that clear? So only thing is you need to think how to position the body for using this buoyancy property. Okay, so this is the first property. The second is hydrostatic pressure. So hydrostatic pressure is pressure exerted in all the direction towards the object. So that means this pressure will give you, will help you to give compression effect. So whenever a patient is having swelling, if you make the person to stand inside water, the limb will automatically get the compression pressure because of the hydrostatic force, and the edema will be reduced. Is that clear? So this is the usage of the second property, that is hydrostatic pressure. Then the third is like your surface tension. So surface tension, again, it will be helping you to increase the resistance and decrease the resistance. That means when you are performing the movement over the surface, then it will be lesser effect rather than, sorry, when you are performing the movement inside the water, it will be having a lesser effect rather than when you are performing, bringing the hand outside and again taking them inside. Is that clear? So that is about the surface tension. Then the fourth one is your viscosity. So viscosity is nothing but again that will be giving you resistance. So this viscosity can be increased by using any kind of whirlpools, like increasing the water flow, uh, increasing increasing the viscosity by adding something else in the water. So this also will give you a resistance. Is that clear? So doing merely in a plain water will be easy compared to increased viscosity. So you can increase the viscosity and increase the resistance. So this is how all the four properties of water you will be able to do, use it for doing exercise, either in a way to give assistance or in a way to give resistance. Is that clear? Then the last one is your temperature. So whenever you increase temperature, it will be giving them relaxation of the body. So when you want to do exercises for a tight muscle, then you can ask them to do the exercise in a little warm water. This will relax the muscle automatically and help you to do the stretching. Is that clear? Okay, so this is about the property. So now it's just a rough brushing of your theory. Now we will go into the practical aspects. So to do this, you need certain equipment. So you can also do without any equipment, but if you have any equipment, it will be little easy for you to do in the water. So that's why we are going to use certain equipments. So here, if you see, this is called floaters. So this equipment will help you to make the body to float in the water. So if you just go and lie down in the water, what will happen? You will get immersed. So if you wear these kind of equipments, this will help you to float in the water. Is it clear? So this is made up of thermocols, so that it will help you to make you float in the water. Is that clear? So this is floater, and this is the hydrotherapy pool, which will be like normally we will be having these kind of pools in the hospitals. So you have one in SP, you also have in Arusha. I think SP1 is not that much used, but in Arusha they are regularly using the hydrotherapy pool. And if you are posted in Arusha, you will get that particular class also. That is like they will take you inside the water pool and they will show you how to treat a patient. Exactly. Yeah. So this is outer is the thing is your um, hydrotherapy pool. Then next is dumbbells. So like dumbbells which we are using in the land, same kind of dumbbells we will be using. But only thing is the difference is the dumbbell is made up of thermocol so that it will be floating in the water. So when you are pushing the dumbbell inside the water, the dumbbell will try to float. So this will give you extra resistance. Is that clear? So this kind of dumbbells will give you extra resistance whenever you are trying to push the dumbbells inside the water. Okay. If you are doing upwards along with buoyancy, this dumbbells will give you extra assistance. Whenever you are doing the movement against buoyancy, then this dumbbells will give you extra resistance. Okay, so these dumbbells are used to give you assistance or resistance. So this is called floating pads or kickboards or pedals. So you can use this to hold and float in the water. Not only that, you can use this to kick on it, so that you will be able to do the exercise by kicking. I'll show you the video so that you can understand more about this kickboards. So next is your noodles. So here if you see this colored one, this is called noodles. So these things will help you to make the person float in the water. Is that clear? So this is how you make them to float in water in supine lying. So if you see, this is called buoyancy belt, which I showed you in blue color. This is called buoyancy belt. So this is of different shape. This is called cervical collar buoyancy belt. So this one you can use only in the cervical level. So I think you would have learned in your theory about the buoyancy points like cervical, um, xiphoesternal level, then waist level like that. So this is for your cervical level. So this will be like a cervical collar which will be worn around the neck. Then you can use the noodles and you can make the person to float. Again, it depends on the person's body weight. He may need extra noodles to make them float. So by making them to float like this, then you will be able to do a lot of exercise. So this is just like making them lying on a cot. Is that clear? So you can see here, this is how you make them to float in prone lying. So if they are overweight, then you can also give one extra noodle in the waist level so that they are able to they are able to float properly. Okay. So this is the dumbbells which they are using. This is how you can make them to sit. So either you can give the noodles under the armpit and you can make them to float in the water and ask them to do exercises in the legs. Or else you can also give the dumbbells, give the noodles to make them sit over it like this. They can also put the noodles in the middle and sit over it and do bicycle. So these are the things which will be helping you to float. And while floating, you can do lot of active exercises in the water. Okay, so active exercises are same like your land exercises. So in land, how you do active exercises are the same thing you are going to do in the water. Okay. So this noodles again you can use it as giving a resisted one. So you can hold over the leg and you try to push the noodle inside, but the noodles is not always will try to float. And when you're pushing the leg downward, you are doing the movement against buoyancy. So that is one resistance. Another resistance is given by this noodles. Is that clear? So this noodles or the floating equipments, like any floating equipments, you can use it for assistance or you can also use it for resistance. So this is the dumbbell exercises which you will be able to do inside the water. Okay, so same wise, we also have something to tie in the legs for resistance, like your weight cuffs. We also have weight cuffs that will be used inside the water. Is that clear? So like this, you can just tie over the legs and you can do it so that this give assistance or this will give resistance. Is that clear? So by standing near the pool, holding the pool, When you are doing abduction, ABD, this is assisted abduction. When you are doing adduction, ADD, that will be resisted adduction, resisted movement. Is that clear? So that is a difference. Then we also can do aerobic exercises inside water. This can be walking in the water, jogging in the water. You have something called water bike, which will be kept inside, and you will be able to do that inside the water like that. Exactly. So you can also do aerobics. So it is not only you can do your strengthening, you can also do your aerobics. So then, depending on the buoyancy level, your buoyancy belt level, the percentage of weight bearing in your legs will differ. So that means if you make the person to float at the cervical level, then only 10% of his body weight will go in the leg. Okay, so if you make them to float at the hip level, 50% of the weight will be going on his legs. If you make them to float in the xiphoesternal level, then only 33% of his body weight will be going into the legs. So in case if you want to give lesser weight bearing to the legs, if the patient is having knee pain or ankle pain and you want to give them a very less weight, according to the height you can do it. If you want to give only 10% of the body weight, then make them to float at the cervical level. If you are able to give 50% body weight, then you can make them to float at the ASAS level. Okay, so your hydrotherapy not only will be helping you to do assisted movement, it also gives you lesser weight bearing. Okay, so that's why hydrotherapy can be used in lot of conditions. So if they have pain, this is the best exercise. If they have edema, this is the best exercise. If they have tightness, this is the best exercise. And if they have reduced muscle power, this is the best exercise. So hydrotherapy can be used to almost all the condition. Is that clear? So now we will see certain videos and I'll explain the videos then and there. Okay. So any doubts so far? Any doubts so far? See, whole of AIMS, we have very unstable internet connection. So even in office also very unstable only. So that's why I'm not able to tie up the LMS. So I was trying to do it. Okay, I think so far I have just added the slides. So far I have just added the slides and I have added the tutorials. Is that clear? Slowly one by one all the videos I will share.
Therapy, by definition, is all about.
So first you see she will explain about some of the properties and how it is working. Okay.
And sometimes
Okay, so can you see here? This is the exact hydrotherapy pool. So you will be having steps to go inside. You will be having chairs will be fitted in the sides so that you can use it to immerse the person or to give rest for the person. And you will also be having something called host. So the host is like a crane that will help you to lift a person inside the lift and take the person inside the pool and bring the person outside. So that you can use use this for neuro patients who are in wheelchair. Is that clear?
all age ranges and all populations. Chronic pain patients, musculoskeletal brain injury, multiple sclerosis, Parkinson's disease. But imagine being in the water, sexually
Please, I think the audio is not available.
Can you see this is how this is one of the way to make them to sit. Okay. Okay, so this is one of the resisted exercises. Can you see? This is called dumbbells. So when you are doing shoulder extension, that is bringing down the shoulder, you are against the buoyancy as well as you are pushing the dumbbell inside. So that will give you a great resistance. Okay. Then one more point I would like to add is normally when you are doing the exercise in long lever in the land, when you are doing the exercises in long lever, that will give less resistance. So if you want to increase the resistance, you also will be doing in short lever. But in water, it is just opposite. When you are doing the exercises in long lever, that will give you maximum resistance. When you're doing the exercises in short lever, that will be giving a minimum resistance. So regarding the resistance, it's always opposite to whatever we do in the land.
aquatic therapy is that it's really an easy way. All of our different ages and populations,
Okay, so this is just a introduction video so that you can understand more about hydrotherapy. So we will go to the other videos. Okay, the problem is the audio. This is the maximum audio I get from almost all the YouTubes. So you can just watch the like hear the recordings once again so that you will be able to understand more. Or what you can do is you can just watch the videos in the YouTube so that it is like in the mobile and hear my class so that it is easy for you to understand. Okay. So when you are coming back, whenever you are coming back to campus, we will definitely have hydrotherapy practical session. So you just keep this in mind. So when you come back, you remind me because we have all the equipments. Okay, so we have a lot of dumbbells and uh, we have a lot of other equipments. Every equipment we have. So I want all of you to come and feel the hydrotherapy property here. So whenever you come back, maybe in next semester also, whenever you come back, we will try to arrange a hydrotherapy session for you. Okay, so but you please keep this in mind and remind me. Maybe when you come back, sometimes if I may forget. Is that clear? Okay, so we will go to the next. So these exercises, you can use it as a warm-up exercises. So normally this water walking was used for warming up. Same exercise when you are using same water walking if you are using same water walking if you are making them to walk in the water without touching the floor, then it will be a aerobic exercise also. Okay, so you can, if you are making them to walk inside water on the floor, then it will be like a warming up. Again, it depends on the speed and how much you are walking. So next is like they will demonstrate how to do active exercises inside water. So this is active like hip flexion. So here if you see, this is hip flexion. So when you see here, when they are bringing the leg forward, that is into flexion, that is assisted buoyancy. Okay, so when they are doing hip flexion in this position, that is your assisted buoyancy. So if you want to add up resistance now in this position, you can wear a weight cuff around the ankle and make them to do this exercise. So that again will give more assistance because that also will help them to float. Okay, so when they are bringing, so when they are doing hip flexion in this position, then it will be assisted exercises for the hip flexion and stretching for the hip extension. Is that clear? Stretching for the hip extension. So you watch the remaining. So this is for hip extension. If you see, this is also again assistance, hip extension and stretching for your hip flexion. Now abduction, again this abduction is assistance and adduction is resistance. When he is bringing back the leg, that is adduction, that is resistance. So here, if you see, the body weight will be acting as a resistance. This is cycling. You can also do this in sitting position. Okay, so this is a simple video just to demonstrate how to do the exercise in water. Now we will go into specific areas.
Be for as long as you can remember. Do whatever it takes to stay that way.
Okay, so this hydrotherapy is very effective for geriatric patients. Why? Because when they are becoming very old, the joints will become very the joint space will reduce, the joints will become very painful, and they will not have much strength in the muscles because the muscles also will undergo wasting because of their aging. So this is a normal aging process. So for those people, if they do water exercises, that will be giving them the best that will be giving them the maximum benefit. Okay, so you can just watch this video and you can know what is the benefits. Mm. Mm.
Exact reverse of what they're trying to achieve through it all.
Okay. Now you can see how to do exercises for upper limb in water. See, first, like you just observe all these videos. Okay, then I will explain one exercises, how to do one exercises, like how to do hamstring strengthening, stretching, like that. Then it will be easy for you to correlate for others. Okay, so definitely I have started to link all these videos in LMS. Okay, so it is getting linked slowly. Maximum in another 1 hour you will get. Ah, வாங்குங்க. So, okay, so in this video, if you see, uh, you you could have seen the same exercises how they did it in the land, they have done in the water. So same exercises, all these are active exercises which you can use at TheraBand and other thing. So that also you can do inside the water. That clear? So let me show you another video showing how to do for lower limb. Okay. Okay, so one more video is there for the shoulder. We'll see that first. Okay, so if you see here, this is shoulder movements, and along with that, in this position, if you do elbow flexion, this will be assisted buoyancy. Okay, this is called as aqua fins, which can be tied over the wrist. It can also be tied over the ankle. Okay.
Stretch it back initially. That means
Okay, so this is called cervical buoyancy belt. Okay.
somebody and just feel this.
Okay, so another 10 minutes video is there, but quickly we will see a lower limb video, then we can come back to here. Because like this, like totally they are showing the shoulder rehabilitation part. Okay, so we'll come back to this video. Before that, this is all active shoulder movements. Okay. Okay, so this bubbling, do you remember when you read in properties, they would have talked something about dragging movements and all. So that is this bubbling. So this bubbles will help you to increase the resistance. So normally it is made in a hydrotherapy pool. So in this video, they have shown how to strengthen quadriceps muscle. Okay, so quadriceps muscle. Okay, so this is the use of the kickboards. Okay. Okay, so VMO muscle means vastus medialis muscle. Is that clear? So that is one part of your quadriceps muscle. So the next video. So this is used for spinal muscles. So all these muscles like exercise are called core muscle strengthening. Okay, so far we have seen upper limb and lower limb. Now we will see one video about the spine and next about the aerobics. Okay. Okay, sorry. Okay, so now, so we saw a lot of varieties of videos. So I think you have got a little idea about how this hydrotherapy is. So it is like you can give any kind of exercises in this. You can give strengthening, you can give stretching, you can give balance training, you can give improve proprioception, you can do aerobics, you can also um, do a lot of toning, everything. Like almost all the exercises can be done in water with a very, very less tension. Okay, so that's what I want to show you. That's why I have just put varieties of video. So now, like, we will just discuss for another 5 10 minutes. Then I'll let you, like, I'll give you some homework for tomorrow's class. So I have some few case scenarios I have posted in your LMS group. So you can read that case scenarios and you can just come with a brief answer so that we can discuss in tomorrow's class. Apart from that, in tomorrow's class, I'll break you into few groups and I'll give you some small things. Like small things means like how to do hamstring strengthening, how to like assistance, resistance, buoyancy, like that. So I want you to discuss the positions, then how you are supposed to do. So that's it. So position of the person and how he is supposed to do hamstring assistance, resistance, and buoyancy. So like this, I'll give you few of the muscles, and you're going to discuss in the group about the positions and the procedure. Is that clear? So that's what we are going to do tomorrow. So tomorrow's class, so that will help you to answer your CQ questions in your midterm. Is that clear? Like I have also given some big case scenarios, like how you would have done for your assignments. So you can go through that and you can also try to answer that so that tomorrow we can discuss and we can finish off our hydrotherapy class. So I think next week also you have your class, right? Are you there? Next week also we have class, right?
So far, our batch coordinator lets us know that next Monday we'll have one pathology class. For PT skill, I'll confirm with Sir lah.
No, according to your timetable, I think you have class, right?
Oh, yeah. But we
Then
have midterm starting next week, right?
next week, your midsum is like your midsum week is 14 to 18, but you may have one or two subjects in next week. Okay,
Yes.
but that doesn't mean that we don't have class. You will
Oh,
be having class during your other timing. So in case if you have exam during our PT skills class, that class alone we can cancel. But other class we will be keep going. Okay? So only from 14 to 18 you will not have your classes. You will have only your exam. Then 21st to 25 it is a midsum break. So next week will be a normal working hours. In case if you don't want your class, you need to talk to the particular lecturer and you can change. That is up to you. Uh, okay, so but I prefer to take class, but you can see if your exam is exactly falling on that time and you can't like you want some time to read, then I can give you break. But otherwise I would like to take the class. Is that clear? So this week we will be like completing our hydrotherapy. Next week we will do our coordination. So by that almost we will be completing three topics. We have two more topics, that is PNF and one more, my topic is re-education. So that we will do after our midsem. Is that clear?
okay, Miss.
So do you have, I think, I hope you would have received your some timetable now. So do you have any exams next week?
Miss, wait for, give me a minute. I'll check.
Now,
Miss, for next week Tuesday we have exam from 8 to 11, and the PDCS class PDCS
PT
at
skills.
11. School is now okay. Okay.
Okay, then any other
There's no
exam
crush,
next week?
no crushing.
No, any other exam you have next week? Only one exam you have next week?
2, Miss.
One on Tuesday and another one on?
Another one on the Wednesday.
Okay, so how you want to have the class? Okay, so you discuss and you let me know.
Okay.
This week also we have 2 hours to replace, so you can just discuss among yourself and you let me know when to have the class.
Okay, Miss.
But Thursday and Friday definitely we will have class because you don't have exams. So Tuesday morning is your exam and after that we have class, right? So I think still it will be okay to have class on Tuesday. Wednesday, when you have your exam, same morning.
Morning 9 to 11, so there's no problem for
Okay.
Tuesday. We can continue the
So
class.
as for exam, no problem, but you can still discuss and let me know.
Okay. Okay.
Okay, thank you. So I'll upload all the links. Okay, so maximum you will get it by another 1 hour. Okay, thank you all.